Everybody, I'm Dr. Mike Calderón, known as Implant Mike on Instagram. So I'm going to show you a little something here. I want to show little skits. Today I'm going to show you about the Yomi robot. Everybody's always asking the question how the Yomi robot works, and basically it is a dynamic navigation. If you can see my first slide here, I'm just kind of showing you that I'm the director of the Long Island Maxi course. I'm also part of the AAID, which is the American Academy of Implant Dentistry. If you're not a member of that society, you should become one, because if we're doing implant dentistry, you need to get credentials so that you can protect yourself and also be informed. Anybody can place an implant, but you have to be really trained so that you're trusted by the population and respected by your colleagues. Next, I'm an ABOI member, which that means I'm a diplomat of the Academy. And I also have the Calderón Institute, which I run also. And today we have facelifts teeth because we're finding that the facial aesthetics and smiles and emotions all they intertwine together along with teeth. So what you're going to find, and because of this video, I'm sure a lot of people are going to get ideas, but you can connect the smile to someone's expression and the expression to their emotional feelings. Their emotional feelings go psychological. Psychological becomes happiness. Happiness becomes success. Success allows you to succeed in life, right? So we're not just doing teeth, we're changing lifestyles. But I want to show you here a little bit about how implant dentistry went forward. This is just a little information so that you know who I am again. LIMC means Long Island Maxi Course. Alrighty, privileges. I'm located in New York. So if anybody wants to reach out to me or even come by and visit the office, I'm in Long Island, West Islip, New York. Alrighty, we're a Maxi Course out here, and you can always call me at 516-852-1386. I love when people reach out because if you come visit me at the office, we'll have a cup of coffee, we'll chat, and I'll just show you all around and I'll share all my info. It's no fun if you can't share the information. Okay, next. So this is what we have. This is called the progression of implants. So when I first started out with implants was back in the 90s. And in dental school, everybody knows what this is. There's some offices that still make partials. And with the gold inlays and onlays. Today, we don't do that. At least in this practice, we do not. So this is something that I use as a demonstration as to what we do not use anymore. But, after partial dentures, we progress into veneers. And when we talk about veneers, what's nice about veneers is you start getting that aesthetic feeling where you start making people happy and they're really happy with the smiles. And it's a challenge. So anybody who does cosmetic dentistry, they'll tell you that they can do this, but it really takes years of training. You can't do this in 6 months. So please take a lot of training already. It doesn't matter where you go, because if you get 5 different inputs, you'll come up with your own. Next is, if you guys remember the old bleaching machine, okay? So for teeth whitening. Teeth whitening is nice. We typically don't do that here in the office anymore because full veneers are the best way to go. Next, you start progressing to implants. These are your standard implants. You place one implant in, and that's the way you should start, and you go forward that way. Now, just because you did one implant, you're going to feel really empowered and successful, and that's great. But it takes at least 100 implants before you're actually well versed in implants. So just continue going forward and get some guidance. Next, after you do the implant, you're going to look at something here called XNav. What I need you to understand is that I'm speaking about the XNav because I have the XNav machine, right? I'm not getting paid by any company. I don't want you to think that. So XNav, wonderful machine. It teaches you not only about where to place the implants dynamically, but also helps you with the treatment plan to get better. Next, once we start doing implants, we start doing the machine for navigation. Now we start looking at sinuses. When we do sinuses, you can do them a few ways. You can either do it inferior approach, which you go in there and you lift it from where you do the extraction or from the crest of the ridge, or you can do sideways when you go to the side by the lateral border of the mouth. Right. So when you do that, that's a little bit of more aggressive surgery. You need to get trained for this. All right. You need to get trained, and one weekend is not going to do it. You need to at least assist on 10. At least that's why I did it, and then go forward and start doing some with somebody else guiding you. And that's what the Maxi course does for you. It gives you someone that you can call for help. And you can always call them 516-852-1386. So once you start doing sinuses, now you start thinking out of the box. So I say out of the oral cavity, because now we start thinking about zygomas. Zygoma implants and pterygoid implants are a whole different animal. Please, if you're going to do this, you really need to get some good training. You have to know your gross anatomy. Your anatomy is key. If you don't know anatomy, or if you remember from dental school, you have to get a refresher course. I recommend taking a gross anatomy program at least every 3 to 4 years. And that will just refresh your memory on the anatomy of the body. We have a gross anatomy course that we give every year, right? And I know this year we're in November, so give us a call and you can find out about that also. Gross anatomy is very, very, very important once you're getting into implants, right? So we go forward. The next machine, which is our front, I'm not going to say final frontier because I'm sure there's going to be something else after this, but this is called a Yomi robot. As you can see, I have one of those guys here also. All right, the Yomi robot, we're in Long Island, and we're the only ones in Long Island that have a Yomi robot, and I'm proud to say that. So if you want to use this Yomi robot, you also give me a call. We'll give you a whole lecture on it. We'll teach you on it, and then we'll guide you on it, okay? The Maxi course also incorporates this in our patient care. Next. This is really a 1 hour lecture, 2 hour lecture, but I'm going to give it to you in about 15 minutes. So what we do here, these are the implants that we place, and they're called guide pins, if you remember. And guide pins are done when we do freehand. After you place the implants in, what happens is that we need to make sure that we are kind of parallel when we're doing this. And if we're able to do that, we do that with a PA. Problem. That means I have to stop the procedure, take an X-ray, and then not develop, but process the X-ray through the machines, or digitally rather say, reevaluate, and then we can go forward. If I have to redirect an implant, this is the time to do it. So the whole point about doing this freehand and you take that X-ray is just to make sure that we're parallel and staying away from obviously anatomical structures like the sinus or the root of another tooth. This is parallelism. All right, so it looks pretty good when we went in there. And so according to this, if you can see the implant to the right, or distal implant, I'm right by the floor of the sinus. I know I'm going to have to do an inferior lift here, right? The middle implant, I can still go on further, and the anterior implant, it's already in about 10 millimeters, but I can put a nice 10, 12 millimeter implant in there. So this is freehand. All right, so after guide pins, we take a PA, position verification, it's called. So I kind of went ahead of myself, but this is only two-dimensional. Two-dimensional meaning that I can see left, right, up and down, but we cannot see in and out. We can't see what's in between. And that's why a CBCT scan is needed. Next, these are the implants being placed. All right, so we place these implants. They're all decently parallel. You can see one went into the sinus. Do you really need to graft a sinus when you go in there only about 2 millimeters? You don't, right? And the research shows that. But, myself, I like to put a little bone in there, and we call it bumping it up. Next, I have Jillian over here. Jillian's helping me out with the practice, and she takes pictures of everybody. So if you see me pose, it's just that, okay? Static guides. Static guides is what everybody's doing now. There's nothing wrong with static guides. If that's what you do, fantastic. It helps you with your treatment planning, the positioning of teeth, because all of our implants should be placed prosthetically guided, and that's what static guides help you with. The only problem is this, is if you're planning on placing more than a few implants with a static guide, and if one is off, or if the bone collapses, that's it. The static guide doesn't work anymore, and now you have to go freehand. So that's the only problem with static guides. And you'll always hear somebody say, and it kind of upsets me a little bit when they say, oh, but it only takes 15 minutes to fabricate a static guide. That's true. You can print it in your office, but somebody has to design it. So you have to send it to someone, or you can design it in your office. It'll take 15 minutes again, and then the emails, and then process and put it into your sprint array and process the whole thing. So it takes about an hour before you get a new one. Meanwhile, the patient's waiting there. So this is what it goes. A turnover time, like I put down there, the extraction site, lack of bone, initial fixation. So this is now dynamic navigation. This is called the XNav. And the XNav is a wonderful machine. I have it, right? And as you can see in the image, you're looking to the right side, right? You're looking at the monitor as you're placing the implant. the top of the image where you see the blue panel, it's actually blue lights which read the QR codes on a handpiece. What's nice about this is that it's pretty highly accurate, but when you see, if you can see on that panel there, on that screen, it's got like a bullseye. That's what you're doing. You're guiding the handpiece to the bullseye, just like if you're playing a video game. It's pretty cool. Problem. If you are looking at a monitor, the assistant has to look at the patient. Right. And what happens is, to myself, I'm not saying this happened to anybody, I can only tell you about my experience, is that the assistant was so impressed with the machine. I was impressed with the machine. We're both looking at the monitor, and then we didn't realize we ran out of irrigation. What happens when you run out of irrigation? You heat up the bone. Okay, you heat up the bone, you get necrosis. How did I find out about this? Because the implant fell 3 days later. It's and the patient was in pain. It is a good thing that the patient was my niece, so I got away with that. But my point is that it works great as long as you keep your eye on the field. Okay, there we go. Next, this is the way it works. I think this is a video, so you can see this.
This
I
is
don't know if you can hear that.
number 30 that we placed using the X navigation. As you can see, we kind of sunk it, which is what we wanted. The angle is a little more buckled so we can load it screw retained. And then I want to take you over here to the 3D view. And that's what we look like. Wonderful. This is going to be screw retained now, and that's what we want.
So that's what we
All
have.
because we are moving ahead with X navigation. Implant Mike, Calderón Institute.
So that's what we have there. All right. So now we go next. Now we got robot assisted, which is the Yomi robot. The Yomi robot's a whole different animal. So what happens with the Yomi robot, I like to compare it to this. If the XNav is a Cessna plane, the Yomi robot, is a jet, right? Just because you can fly a Cessna doesn't mean you can fly a jet. So you need to get trained, right? You need to get properly trained by someone here that's involved with the machine. So that's my jet. I'm going to show you this. So if you guys remember in 2002, what happened, how did we do implants? Somewhere like then. We would do a suck down, if you remember, okay? Basically a suck down on a machine. And then we would just put some kind of pins in there to give us an idea of where the implants were going. But bottom line is we're doing it freehand, but it gives us an idea. So what we have here is, once you get a little more advanced, as you can tell with the year, it's 2004. And when it's 2004, what happens is we have, experience guiding you. We have to follow straight with parallel with the roots of the other teeth. We're constantly moving our head around and our body. We're shifting our bodies all the way around so that we can make sure we go in the right position three-dimensionally. And that time that your body's so like a contortionist, you're like upside down because you make sure you're making sure that you're getting this in the right position. Then we go forward, and then you got 2022. 2022 is the Yomi robot. And like I said, we have the Yomi robot right here. And this is a wonderful machine because now we're putting the whole treatment plan into the CAT scan. Once the CAT scan is done, we program the machine to follow what we have come up with on the CAT scan. And it puts it within the 10th of a millimeter to the position that you want it in. All right. The setup takes a little longer, but the accuracy is definitely there. As we go forward, I'm going to show you a case here where we're only placing tooth number 14 here. Okay, so this is a mirror view here. So then you can see there, all right, that's the implant that we placed with the Yomi robot, right? That's the angle that we placed with the Yomi robot. And as you know, with all implants, we want to have enough bone on the buccal and definitely on the palatal, but mainly on the buccal. So I'm going to show you a little bit more here. This is me, and I'm just basically talking about what we're going to do. So I'm going to kind of skip that, right? Because that's my office, and I know it looks weird, me dressed all black, but we change colors. But you should come by and see this. But this is the actual Yomi robot, and I'm going to show you how we're going to place this implant here. So there is the arm that we use to place the implant, which you're going to see me using, and then there's another arm that's attached to the patient's arch, the same arch we're working on. What's interesting here is I'm placing this implant with my left hand. I'm right-handed. So that's what you need to understand. So this machine really is doing everything. The only thing I'm doing is pushing it apically. Obviously, we got to watch that the irrigation is running, but the surgical assistant now, they're not called assistants anymore. We're all team players because they need to know exactly what's going on. So it's a pretty impressive machine. As we're placing it there, I'm going to show you. I mean, we have another 45 seconds there, so I want you to kind of see it. But this is the pilot drill, if you know this on implantology. If you can see on the patient's right side, that's the arm that's linked to the arch. That arm communicates with the computer, which the computer communicates with the arm so that we can place the implant properly in 3 dimensions. Right, so mesial, distal, buccal, lingual, and apical. It will not let me go too deep. Or if I'm not deep enough, it would also tell me I'm not deep enough. Great machine. Expensive, but great. All right, so that's pretty much it there. Then this is one of the steps. Basically, they're not going to really tell you this when they come show you the machine, because once you purchase it, they have to go through a whole training for a few days. And it's about measuring devices and all that stuff. The machine is always accurate. And as we're going, constantly with my left hand, and I'm right-handed. So now today I'm able to ship with no problem any hand you want. Right, that's the machine working there. And it's just same thing. Every implant system fits. It's just a handpiece, right? It's just a computer now running everything instead of your hands. Let's see what we have here. So this is the plan for that implant. This is the plan. This is what I came up with on our CAT scan. This is just an image showing you that I'm a little too buccal. All right. If you look at the axis of the implant, it's way to the buccal of the lower teeth. Remember, we're prosthetically driven. So as we're looking at this, it's too buccal. So now I redirected it. As you can see, the angle's changed. And if you can tell, the angle is different when you're comparing it to the buccal wall. So it's more parallel on the image I just showed you. All right. And now it's hitting the lower tooth. And that's what we want. See how it's tucked in now? So that's the implant that was placed according to our plan. Can you see that? Can you see how they are so similar? I'm going to show you, I think, on the next slide. This is the plan that we did with the CAT scan. This is the plan. This is ideally where I want to place the implant in the proper depth, the proper buccal lingual position, and the proper mesial distal. All right, and also the depth, because I like to countersink it right there. And that's it. Pretty similar. So I superimpose them to see how it looks. If you see the superimposition right there, I'm right on. That's what the machine did. That's what the Yomi did. This is the implant placement. I put a healing collar right away since we got over 35 Newton centimeters torque. That's the implant being placed with the Yomi robot also. So what's wonderful about this Yomi robot, like I said, it really kind of takes, if you're just starting out, you need to get trained first on the Yomi robot, and then you'll be able to place implants. But what I found it's best, I did this for demonstration because I could have done this, freehand or with another machine. But what I found is that if you're going to be placing an implant in between 2 implants, and it's very, how can I say, narrow, and you have to be dead on with your accuracy, the machine was very helpful on that. So I had a few cases that way, and the machine just eliminated that worry. Here goes again. I believe this is a different case. Again, as you can see, I'm switching. I'm showing you how the arm is there, and I'm just switching straight from right-handed to left-handed. And this is for lower now. So if I'm that comfortable to switch from one hand to the other, that's just showing you how much I'm already trusting the machine. You have to start trusting the machine, start trusting the panel. So this is one of the things I like to say about a positive emotional energy, right? It's allow yourself to be a beginner. No one starts off being excellent. Many people have programs to look at being a beginner as the worst thing, so they don't even try. So embrace the significance of continuously taking small steps. My message there is this, is that, even though I've been doing this already for over 25 years, right? And, even though I've been doing it for over 25 years, I still take courses. I still take programs, and what's nice is that all of these lecturers, they get to know you, because even though you're at a higher level of your knowledge or experience, you're still looking to get somebody else's experience to learn more. The better you are, the better it is for you and the patient. All right, so don't be embarrassed about going forward, because at our Maxi course, at our Calderón Institute, we have people that come in that are only 3 years out, which I think is a little early, but 3 years is good. 1 year out is not enough. And we have others that come out after 25 years of taking it. So right now, our oldest resident was 62 years old, and he just started doing implants, and he says just opened up his whole world for him again. So he allowed himself to come back. In his first few weeks, he felt it. He felt uncomfortable, because obviously you can tell he's a little older than the rest of the team. But at the end, everybody's hanging out like teenagers. It's just a wonderful time. So this is one of the groups here. This is the panel here, and I'm going to put the volume up here so you guys can hear this, because this is their first experience with the Yomi robot. All right, and this is what we do.
2, 3.
I'm Dr. Nick Ladotti.
I'm Dr. Mo.
We just placed an implant with the Yomi robot, and I have to say, it was an amazing experience.
Flapless, where we had planned is exactly where the implant went. Pre and post CBCTs.
No second guessing, all guided.
All
Amazing.
guided. Just go right through once it's been planned. Nothing else is needed.
The only machine available is at the Calderón Institute. I strongly recommend you check it out.
And I strongly recommend you come to Calderón Institute to learn how to use the Yomi robot.
Thanks again.
Take care.
What was really nice about that video is that I didn't know they did that video. It wasn't something that we planned. At the end of the day, they told me, "Hey, did you see our video?" I go, "What video?" They go, "Well, we gave you a good video there." And that was kind of a great gift from them, because it just shows that we want to make you better, right? And really, just take down the information, come see me, and you can always text me, call me, whatever, on Instagram, Implant Mike, and just ask me anything you want. I don't get offended at all, from anywhere in the world, because my wife also, she got used to me getting phone calls from overseas at 2 o'clock in the morning, so it's okay, right? This is my next message here. So that's me, Implant Mike, on Instagram. Every morning I start off with a suit on and a cup of coffee, thinking about what my plan is going to be. And I stress myself out that way. And I think that once you start thinking this way, you're going to go forward, because once you stop thinking this way, most likely it's time to retire. Okay, so always plan ahead. Never give up. I love this little slide here, because this little slide, you got to see this, Jillian, if you like this slide here. Never give up here. It's a cute little slide that has the mouse trying to get his cheese with a helmet on. Okay, so when I saw that, I go, this is exactly what we need to do, right? And that's our schedule, right? You can look at our schedule there. This is going to be, it changes every year, but I just put that up for next year. But that's it, guys. Thank you very much for everything. Peace out. I'm out of here.